phone. Can you get the phone? Oh my God, no.
What can we do?
Come here. Hi, my son is having a seizure. He's 20 months. Okay.
When Ethan had his first seizure, his eyes rolled to the back of his head, he starts foaming at the mouth, his body stiffened.
It was just a terrifying experience.
I was 8.5 months pregnant with our daughter. He had the next seizure. When he was taken to the emergency room, the treating ER doctor gave him Versed, which caused him to be intubated, which caused a secondary issue of snoring at night. So we had to see an ear, nose, throat doctor. We were told to follow up with a neurologist, which of course we didn't have one, so we had to find one. They wanted us to put Ethan on anti-seizure medication, and they said it will change his personality and there are side effects. Having the right epileptologist, especially for a child, is crucial in helping them live a successful and normal life.
And the path to finding that is incredibly challenging.
Nico, if I had to describe him, I would say he's a really creative kid, great energy, fun to be around. We were walking. He stopped and paused and started drooling, and his arms started raising. So he is an imaginative kid, big personality. So I thought he was trying to act like a zombie. He was so creative. Like, he would do short films. Like, never in my mind would I have thought that he was having a seizure. The next day, he was with his father, who is a nurse. He had a seizure with his dad.
It's okay, bud. It's okay, Bubs. Right here.
From that point on, I had a lot of PTSD nightmares because I felt so guilty as a mother, not noticing what was happening to him. We went to meet with the neurologist, and he put him on Keppra. Nico became extremely suicidal. We went back and forth, changed different medicines, and so we still didn't have really any answers. You're so consumed in doctor's appointments. I think it was challenging, definitely for all of us. My kids have said they felt like they kind of weren't seen during that time, and I can't take that time back.
Ethan first came to see me. He was having initially febrile seizures. So I was discussing with the family different options and plans and what we should do moving forward. And I really felt we should do some genetic testing. We reached out to our friends around the world, and we found a lab that was actually doing research on his gene. They found that Ethan actually has a very unique mutation.
One child in the world that has this specific gene mutation.
He's the only one that we know of so far that has it. So this not only enabled us to know exactly what's wrong with Ethan, be able to treat him going forward, but we've now advanced the understanding of this specific genetic disease for really the entire country and the entire world.
We're going to have to deal with this for as many years as it may take. We at least had the right team on his case.
I just remember meeting Dr. Holder for the first time. We walked in her office and, oh gosh. And I remember her seeing my son. Like, every doctor we had gone to talked to me. She closed the door and she came in and she looked at him and she saw my son. And she asked him questions, and she asked him how he was doing and what he thought. And right away, she's like, "You're on this medication? Man, you must be hungry all the time. We're gonna get you off that medication."
So Nico was an interesting case. He came to me with really kind of difficult seizures. He would go many days without seizures, and he would cluster and have seizures back to back to back to back that would just wipe him out. And it was really just troubling for him and his family. Otherwise, he was really a great kid and really did all the other kind of normal kid stuff, but just the seizures were really troubling him.
She just explained things like articulated things so I could understand and so Nico could understand. And
When I looked at his MRI scan, I knew as soon as I pulled it up, he most likely had a genetic disease that we call tuberous sclerosis.
it just felt like, oh my gosh, like there's answers, like there's like a direction.
We did ultimately do genetic testing and confirm that diagnosis for him.
Hope came to our heart. Like it just felt like, okay, like okay, we're going somewhere.
So we were pretty confident from the beginning, the very first day I saw him, that we could probably fix him with surgery.
We have a whole clinic here at Children's Hospital. Here's Dr. Ross. She just introduced, and hey, if you need any help with social work, and here you go, and here's this person's got, it was like this team of doctors who just became like your extended family to walk this journey with, like to give you hope for your child.
Oh, I just had my surgery. Hey guys, they drilled up over here and I'm feeling way better than I did yesterday. And I just want to say I'm very thankful for the prayers, and I want all of you to know that they were received. And thank you, and bye.
So we think about treating patients in the new age of genetics as precision medicine.
The nice thing for a lot of the epilepsy genes is that we're now in that 5 or 10 years out, and we're starting to identify more and more children who have changes in each of these genes.
Parents always ask me, am I going to have epilepsy for the rest of their lives? Is my child going to continue to seize throughout their entire childhood and into adulthood? And I always say, well, I didn't bring my crystal ball with me to work today. I can't tell you what's going to happen in the future. But genetics is, in a sense, our crystal ball. I honestly didn't think I'd see this in my career. I didn't think that we'd have all these genes, and I never thought we'd be able to use them the way we use them, be able to have medication treatment, and I never thought I'd see gene therapy in my lifetime. I really didn't think I'd still be practicing medicine and we'd be doing trials on gene therapy. We're doing a trial right now on gene therapy, and I never thought I'd see that. So we started an epilepsy genetics clinic where Dr. Dierdorf and his genetic counselors are available to see patients the same day we see them.
Earlier testing gets us earlier diagnosis, gets us earlier kind of optimized treatment.
Once we get the genetic diagnosis, then we're able to treat the patient based on the genes that we find. It allows me to pick the right medication. It allows me to stay away from bad medications. It allows the families to connect with other patients around the world that have the same genetic disease. And now, today, it may allow me to enroll them in a trial for gene therapy. So it really opens up a whole new world of treatment options for our patients.
The stress of dealing with any medical issue is enormous, but when it comes to your children, it's exacerbated.
Ethan riding his bike, day 1. All right, stop. Put your feet down. Good job.
We had to go through this the hard way, and we got to the right place in the end.
You need someone who's going to explain what's going on and make good choices for your child's life.
Finding the right pediatric epileptologist is so crucial for families with children that have epilepsy.
Having access to such outstanding medical care that's approachable, caring, and so incredibly knowledgeable is paramount importance.
We now have this amazing epilepsy genetics fellowship that I think is just phenomenal, that we can train doctors that are as passionate as we are about genetics and epilepsy.
What's better than Deb and I working together to do this stuff? Teaching other people to do it as well. So.
Yeah, we love teaching. None of this is possible without the support and passion that Care and Cure gives us.